All right. Oh, yeah, I see it's blinking. Blink, 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 blink. All right. Up, there we go. Guess I'll get going. All right. I'm going to call the Personnel and Finance Committee meeting to order for April 14th, 2021. We'll start with courtesy of the floor. Is there anyone here who would like to address the committee? Seeing no one, we'll go into the next order of business, and that would be the review of the county executive's appointments. And the first appointment is for the Airport Authority Board, and that would be Dawn Godshall, 231, I don't like to do that. Dawn Godshall, Northampton, Pennsylvania. She'll have a 5-year term to begin April 16th, 2021, and end December 31st, 2025. Are there any questions regarding that, or?
Motion to move?
Okay, fine. That will be moved on then. And then next, that was it for airport. I think the only thing then, appointments is Graysdale Advisory Board. So we have, I'll just read them off because then we can either, somebody can have an objection to one or two or whatever, or otherwise we'll just move them all on as a packet. All right, so I am submitting the following individual for appointment to Graysdale Advisory Board. Eleanor O'Donnell, Eleanor O'Donnell, Nazareth, Pennsylvania, and she will serve a 2-year term from April 19th, 2021 to end April 19th, 2023. Ms. O'Donnell will be serving as the Area Agency on Aging Liaison. Okay. Then I have, the next for the Graysdale Advisory Board is Bill Ryan, Easton, 2-year term, April 19th, 2021 to end April 19th, 2023. Then we have Mary Ann Schmoyer, Bath, Pennsylvania, 2-year term, April 19th, 2021 to end April 19th, 2023. And then we have Luann Vogel, Nazareth, PA, a 2-year term, April 19th, 2021 to end April 19th, 2023. And that is the oh, I'm sorry, there's 2. Did I get those? All right. I also have Graysdale Advisory Board, Sharon Volkert, Easton, Volker. Wait, hold on, excuse me. Is that just a mistake? That's Volker.
It's perfect.
All right, that's Volker. And it's a 2-year term beginning April 19th, 2021 to end April 19th, 2023. And then finally, I have James Irwin, Nazareth, PA, 2-year term, April 19th, 2021 to end April 19th, 2023. So there we go. Anyone have any discussion? Question, Mr. Kusick.
Yeah, I don't know how to address this, but I think I have a technical objection to all of them, and that relates to Section 1002 of the Home Rule Charter, which Part A clearly says the county executive shall have the power to appoint the members subject to the confirmation of county council. However, these appointments, most of them expired either in 2019 or 2020. So consequently, in Section C, under confirmation, it tells us that an appointment shall not be effective unless the county council by resolution confirms it or fails to reject it within 30 days after the appointment. Okay. The appointee shall serve until so rejected by the county council or until the expiration of his term of office, whichever is sooner. Well, these all expired, so that is what we're doing here. Now, this next sentence is what I think is relevant. It says, if the court or the county executive fails to appoint an individual to fill a vacancy on an authority, board, or commission within 60 days after the occurrence of the vacancy, the county council forthwith shall make the appointment. So I think my concern here is that these are appointments from the executive, and my understanding or my simple, plain English language reading of the charter makes it appear to me that these should be made, in fact, by county council. So, thank you.
Yeah, I specifically went and reviewed that after your comments at the last meeting about, brought this up at a full meeting. My only thing on this is, first of all, I agree. I mean, it's pretty clear in the charter. So we would then be the ones to come up with a nomination and put people forward. But I mean, this is a situation where with these names, he brought them. Now, I mean, I believe when it comes to the charter, we're in a position, do we want to enforce that and then start ourselves to go out? But we have names in front of it. I know, you're right, some of these names are familiar because they were on. Personally, I don't have a problem with moving these forward to vote on as they are. I mean, I probably would go through and say, I'd like to nominate so-and-so. So I get what you're saying, and I mean, if Mr. Spadoni wants to weigh in, I agree that you're correct, absolutely, that's what the charter says, and you know I'm a stickler for the charter. So the thing is, but at the same token, I think we could take that extra step, but I don't have anybody in mind, or no one's talked to me. I don't think we'd be out of line if we said this is something we want to do, even though he brought them to us. But that's just my interpretation. Mr. Spadoni, do you have something you'd like to add?
Why don't you let me take a look at it and then maybe move it for tomorrow night, and we'll decide whether you need a resolution or you
Yeah.
can take these names.
I mean, yeah, otherwise, I mean, we'd stop, we wouldn't do it, but then somebody would bring in people and I probably would bring in a lot of these people. Ms. Hefner.
Well, I would just ask the question that I wouldn't look to replace any of these people per se, but I think if it's simply not accepting it as an appointment and making it as a resolution that we are putting these names forward, then I would sponsor that. You know, because I think some of the people on here are very dedicated to Graysdale.
Yes.
And I know that the fact that there's somebody that was selected for the area agency liaison, as well as having a nurse on there, which we needed to replace a nurse from when I was on there, and there was one resigning. So I think the personnel is not an issue, it's the process.
Oh,
So I don't know
Great.
if people would, I would be amenable to
right.
that.
Yeah, and I would just, if I could just follow up, I mean, and if a member of council would like to, make a motion and say, I would like to appoint these people, I think that would be appropriate. But what I don't think that is appropriate is that the county executive no longer had the power to make these appointments. That responsibility fell to county council.
and I agree with you.
So-
And I've already in times wanted to cross the Ts and dot the Is, and sometimes I've gotten a little bit of trouble over that. But I mean, you're right, though. If she were to say, I want a resolution, I want these to go forward. So that's the technicality. But Mr. Spadoni wanted to add something.
Linda and I tomorrow will have the appropriate resolutions for council tomorrow evening. Okay, that's a good idea.
And then make it a slate of names.
Well, yeah, we would be moving.
Appointed by this body.
We can set the resolution up with the slate of names, and just like what we do in normal situations, if someone has an objection and they want to pull a name out, I mean, I forget how many people, I don't know if this fills the board, I don't remember how many were on. Ms. Hefner, do you remember how many were on at one time, the advisory board?
We need
Five.
7 to 9 is like.
All right, I think we've got it covered. Well, Mr.
And then you're on
Spadoni,
there as well, but you don't need to be.
I'm a
on this
liaison,
list
I think.
as
I'm just a
liaison as
liaison.
well.
Yes,
Just to clarify, we'll do one resolution authority as
Yeah.
the county executive. And
Yeah.
then we'll do another resolution listing the same data, but saying different wording.
Yeah, and again, I don't have an issue with that. I just think that it should be done in the way prescribed by the charter. And I think one of the things that I would suggest for future reference is that we used to have a list somewhere of every board authority. Do we still have that somewhere? Okay. So we used to get that at the beginning of the year, and it's something that council should have access to. And I don't recall seeing it lately, so if we could get a copy of that, I'd appreciate it.
We do have a list of all, it's actually a binder full with them all, of all the authorities, and then when they meet and everything. Again, we don't check the time of expiration due to the fact that we don't make the appointments, but we can give you the,
Well, again, this is a situation where when the executive fails to, that does fall to us as our responsibility. So if we could consolidate that onto a list somewhere that would be easily referenceable for members of council, that would be a good idea.
we can
Okay.
do that.
Mr. McGee?
Yeah, no, it's good that he picked up on the process, and I'm assuming that's the case here. And I know the solicitor's going to look into it, and they're going to correct it with the resolution. I'm in support with Ms. Fargo Hefner as far as supporting a resolution. I know some of these folks, I see the names, they're familiar names. I know they care a lot about Gracedale, and I think, they're a good fit.
Yeah, I think the name, I mean, personally, I agree, because these people were on before, and I know Mr. Kusick speaking to the specifics of the charter, which, as I said, I reviewed, and yes, the charter is pretty clear in this area, like in some other areas, but I think it can be remedied by our solicitor in time for tomorrow night.
I do want to mention, though, we did have a pandemic, and I know some of the stuff and some of the reasons why the board didn't meet. At least I was clued in,
Yeah.
over the recent dialogue over the last month or so. So, thank you.
Yep, we'll move along. Oh, Mr. Myers.
Sorry, I was late, I was detained. What exactly are we talking about?
All right, we're filling up vacancies on the Gracedale Advisory Board. And if you recall from the council meeting, that discussion was brought up that it hadn't met in a long time and they expired. And we needed to fill the advisory board vacancies. Now, there's provision in the charter that gives a time frame by when we're supposed to get those recommendations from the county executive. That time frame lapsed. Now, and he did explain there were various reasons and issues, but the charter says after X amount of days, then council, if the courts or the executive don't put forward names, council then has the obligation to do it, or the authority. And Mr. Kusick was bringing that up, and that's what we've been discussing now. And I referred it to our solicitor, so we're moving it forward to tomorrow night to do it. And he's going to probably put together a resolution which will resolve the charter question. Like, I don't think there's any question about the people. You'll have a chance to weigh in on the names. I mean, I would probably move that, as a member of council then, I would move that we put all these people on the advisory board. And if council were to vote and agree, then technically we're bringing it forward, and we're abiding by the letter of the charter. It's just getting into the nuts and bolts of,
It's about also the solution. It's just make it.
we've got a solution we're working on. That's it.
I mean, Mr. McGee was quite correct, but the fact that we did have a pandemic,
Yes.
and there's a lot of things that we did because of the pandemic, so we're red flagging something like this?
No. It's just, he brought up something that's in the charter, but I think it can
Of course
be,
he did. I mean, let's just deal with the fact. You get more fire to, you add more flame to the fire.
well, the charter's full of flame if you look for it. But the thing is, we're gonna handle this and we'll get it straightened out tomorrow. How's that?
Okay, I'm gonna bite my lip for now.
Okay, you bite that. All right, any
I'm about
dis-
to explode.
any
So are
other
we clear?
discussion
Do we
before
need-
Mr., wait, I'm in charge.
I know you are.
Mr.
I have my
Myers'
hand
lip
up. Do you
bleeds.
see that?
Well, I see that. I don't know, what is that?
It's a question.
Talk to the hand? Oh, I'm sorry.
So are we clear, or do we need to make
No.
a resolution today, or
No.
we're all good?
No, the charter permits a resolution to be presented at a meeting by any councilman,
All right, so
so we're in good shape.
just checking on procedure.
My hope would be that now we're moving past this. Okay,
Second.
yeah, we're gonna work on it tomorrow night. All right, now, next. Wait, who's that? Oh, I thought, you didn't sound like Tara. I didn't know you were on it. Tara was on. Go-
I can't hear him, hold on.
Hold on, Kevin. We're trying to make it so you can be heard.
Go ahead,
Are you underwater or what?
go ahead.
Oh, point of
Oh.
clarification, this is only for the Graysdale Board, the resolution, not for the Airport Authority, correct?
No, correct. Airport's fine, no problems.
Just wanted to clarify that. Thank you, Mr. President.
Well,
He's not the president.
I'm
He's the
sorry,
chair and the king and the
Chairman.
ex-officio.
Committee Chairman, when you're on the phone, you can't see all this stuff.
I agree. I think we're in good shape. Yeah, that's just for Graysdale. The airport authority is fine. And, all right, if that's that, I'm going to move on to the discussion regarding the personnel request for the Department of Human Services, Graysdale. And what we have is a request for a position. Sorry, I was moving my papers around so much. Yeah. Let me keep going here. I think I have it here. Here it is. All right, we received a memo, and I think, I don't know if you got it, but did everyone get this? Mr. McClure, and a concern at Graysdale would like to respectfully request the approval of converting one FTE RNAC position to a newly created one FTE RN infection control position. The position eliminated is a grade 27, with the new position being a grade 26. The newly created position will work under the direction of the infection control coordinator to facilitate and aid the infection control measures at Graysdale. And specific job functions will include, but not limited to, infectious disease tracking and reporting, testing, auditing, educating resident and staff, and monitoring facility infection trends. So given what's been going on, I mean, to me, it sounds like a pretty important positions. You have the sheets attached that get into the nuts and bolts of it. And a discussion? Mr. Kusick?
Yeah, just one question. Does this position have any supervisory responsibility?
There is a LPN in the department, so they'll oversee that person, but really the coordinator is the person who oversees that department.
Okay, and the reason why I asked that is because I noticed that it's a non-union position, it's exempt. So my question is, why wouldn't this position be under the steelworkers union?
Career service usually held the infectious control positions. That's why we just assumed to put it under the career service. The charge nurses are the steel workers, so they're on the floors.
And what about the RNX, which is the position?
They are career service.
They're what?
Career service,
Career service, they wouldn't be in the union.
right.
Now, go ahead, you want to, you have the
No,
floor.
it struck me as unusual. I didn't see any supervisor responsibilities indicated in the job description. I saw it was non-union, and I was wondering why they weren't covered under the steelworkers contract. So, I don't know, that's,
I mean, I know you're going by because of supervisory with career service, but I mean, we have other career service that are not supervisory.
Right. My RNAC department, there's only one supervisor and there's 6 or 7 that work with her. They are career service as well. All the supervisors that fall under Dawn are career service. Secretaries in the career service are all career service.
Now, the position that's being eliminated, is that career service as well, or is that?
Correct, it is.
Okay, so we're swapping one for
Right,
one.
just swapping.
All right.
All right. Ms. Bargo Hefner?
And you're okay to let go of that position? Because I
We-
thought we just added. an
We
RNAC.
did, and COVID hit, and it's a necessity to have, because of everything that we learned through COVID, infectious control is paramount. So we would like to utilize that position just for that. We saw from all the surveys that we had, whenever DOH was in, they had focused infectious control surveys. So we really needed to firm up that small department because infectious control is everything.
Okay, thank you.
Yeah, I agree, and I would just say if the position you're vacating, you find is still necessary, but I know how that goes. You ask, you get one, give one.
I still have
let
one
us
other
know.
one.
What's that?
I do have one extra one that's still vacant in the
Okay.
RNAC position, so once.
Oh, I see, you have a
Yep.
vacancy. Oh, all
I
right,
do.
good. Well, hopefully you fill that soon. Mr. Myers?
I don't see a real problem with it. And plus, at the last time we met, you were eliminating a whole bunch of jobs at that point. So, adding to this. Is this person also going to have some input with your maintenance facilities people to overseeing anything, make sure that they see anything gets cleaned right away?
Oh, absolutely. Absolutely.
'Cause I
They're,
didn't see that in any of the description part, that she's working hand in hand with, he or she is working in hand to make sure we're on top of making sure it's a safe environment.
it is throughout Graysdale that they oversee. So that's why it's imperative that we have 3 members. With all the testing that we have to do, we go between 1 times a week, and we're close to doing it 2 times a week, and that person runs that. So right now, we just have 1 coordinator, and she's running amok.
Yeah, we don't want to beat her to the ground. She's not useful for us. All right, I don't have a problem with this. I can recommend that we move forward.
All right, I have a motion. Yep.
Second.
Okay, good. It'll be moved forward then to tomorrow night. Any other issues for the Personnel Committee? If not, meeting's adjourned, and I turn it over to the Honorable William McGee.
Thank you, Chairman.
There goes the neighbor.
Good afternoon, everybody. We're going to start the Finance Committee meeting. Courtesy of the floor at this time. Seeing none, right now we have one item on the agenda. And I see Mr. Barron in the back of the room.
Oh, I thought I saw him
This is a budget amendment,
slumping back there.
DCED Emergency Rental Assistance Program,
Isn't this the one that we sponsored?
emergency rental assistance increase in the budget.
Yeah, so these funds are the human service end of the rental assistance program. So since we have been running the CMED program out of DCED, Human Services is actually getting their own $11 million pot of money. It has some different rules, but largely runs parallel with what we're doing with the CMED program, i.e. it's a different box of money, it's a different bucket of money to get rental assistance and things like that. It also will allow us to extend the HUD funds through the CMED program and start to delve into a little bit more of the housing sustainability. We do a lot of housing sustainability now with regard to repairs for landlords, helping to increase the rental stock so that people are getting good money or getting good properties for the rental money that they're paying out. That being the case, we're looking at some of those programs and maybe extending those, but we have these buckets of money that we can pull from, and we're going to be doing that on a rotating basis. We're still going to be using the same tenant navigators basically everything you've heard from CMed is going to translate over into this program. Since it is human services money, it will reside in human services budget line items, but it will be managed hand in hand with DCED. Right now, the way the CMed program is working is my department is the final check and balance before the money goes out the door. Robin Barbosa, who is in the back of the room, is actually quarterbacking the applications along with a manpower temp that they have in there, who is actually, processing the applications, making sure the tenant navigators are doing what they need to do, and then getting them over to us for payment. Gary Rushman is also part of that team as well. So that's sort of how everything's working. This just gives us another bucket of money to pull from.
Question, is it, so just so we understand it, does this go directly into the tenant or the landlord,
So
landlord?
the
or
way the program works is you as the tenant who can't meet your rental payment, you go to this tenant navigator. The tenant navigator gathers all the appropriate documentation to make sure you qualify. Under the HUD guidelines, it's 80% of the median income level for the Lehigh Valley. The median income level for a single person is $81,000, okay? That's where it's at for fiscal year 2021. At that point, they look at how many dependents you have and all the other things that go along with that. As long as you're within that 80 to 50, or if you're severe poverty below the 50% of that, then you qualify for this program under the CMed. You may qualify under the new ERAP money that you're gonna be approving now. At that point, your application for utilities or for rental assistance comes to the county. Your landlord must agree to take part. They sign off on it, and we direct deposit the money or send electronically to the landlord that money. Now, it does not mean you can't be evicted for other things, but just not for non-payment. We're also doing the utility assistance as well, and some of this ERAP money can be used for utilities. We've had meetings with PPL. They've actually given us access to their system so we can see how far people are behind, and work with them to create a sustainable plan for somebody going forward so they don't lose their utilities. We're working on that with MedEd, and we have a good relationship with UGI. So we're working on all of those programs, all of those utility companies, and the various water companies.
That was the next
Yeah.
question. The city, the water.
City of Easton, Bethlehem, and then Easton Suburban.
Now, with this rental thing, the landlord agrees in that, and they sign a paper.
Correct. We've had very, very little resistance from the landlords because obviously they're getting paid. There are some landlords who are hesitant, and we're working. The bottom line is we don't want to give tenants a whole bunch of money and then they don't pay their rent.
Yeah, exactly.
We have taken great pains, and I think Robin would echo that. We've taken great pains to make sure that we don't give people the money and then they don't pay their rent.
Are you done, Mr. Myers?
Yes, sir.
Okay, Mr. Heckman.
I think if anybody's out there listening on the inner tubes, yeah, they probably like jerked their head back when you said the median income in the Lehigh, and in county or the Lehigh Valley,
That's the HUD guideline for the Lehigh Valley.
$81,000 for one
Approximately,
person. Could you, and this is for a point of clarification, could you explain the difference between median income and average income?
Yeah.
Mr. Cusick's salivating, but I mean, it's a quiz, Steve. Go ahead. Knock him over.
So everybody's hearing that. It is the number that the federal government comes up with based on the job stock in the area. It is based on urban communities and cost of living in that general area. So we are helped by the fact that we do have some rural areas, which drives that cost of living down. But remember, we are between New York City and Philadelphia. So while we are a great metropolitan area or a suburban area for the rural farmland and all that other stuff, the Philadelphia and New York metro areas do increase that number. And again, it is a federal number, and the calculation that goes into it really does bring that down. So if you're a family of 4 and you're within 80 to 50%, so now you're qualifying at, you know, a much lower rate. There are you're qualifying people who are at a much lower rate. More people do qualify, but they might not necessarily fit every program because they're all different.
Well, I'm thinking of like the math involved, because I mean, average, you take 20 people, what they all make, you divide it by 20, and that's your average income, which can be skewed by the guy making $1 million. But with median, the formula is supposed to eliminate that, correct or
Correct.
incorrect?
And remember, that also takes into account 2 working adults in the household.
Okay,
Okay, so if you have a family of 4, that 50% of the median income is now $40,000. And for a family of 4, that doesn't get you very far. So at that point, you would qualify for assistance. Now, how much assistance depends on what kind of rent you're paying and all the other stuff during this time period. Just to give you like round number examples.
thank you.
One question, if anybody else has. You see more coming, or is this from the recent American Recovery Act?
So it is from the recent, this money has, the reason we put this in front of you and didn't bring it right now and didn't bring it with the budget amendment we're bringing to you in a month is simply because this money has a tighter time frame than the CMed money. So as we're looking at the buckets of money that we're trying to spend out of, this money will probably largely take over the rental assistance as well as the utility assistance for the foreseeable future. We're also balancing very carefully because we do pay our tenant navigators. So there's sort of a balancing act going on with the pots of money because we want to make sure we do not exceed our administrative fees. We have great partners in our tenant navigators, the Third Street Alliance. I knew I would forget the other 2. Ross Marcus works for the other one. I know the people I deal with. Who are they, Robin? Project of Easton, Third Street Alliance.
Neighborhood Center?
Easton Neighborhood Center. And New Bethany Ministries. There are 4. Thank you. I'm sorry. I know the people I deal with. I just don't necessarily know the companies. I apologize.
Excellent. Thank you. Anyone else have questions?
Over here.
Oh, Mr. Myers.
What about those seniors who are on a fixed income? They ain't nowhere near 80,000.
And they qualify for these programs. And actually, a lot of the tenant navigators are used to working with our seniors. And if there is a need in the Area Agency on Aging, one of the reasons that a lot of that this particular program resides in Human Services is so we could take care of the seniors. And if somebody can't make it out there, obviously our Area Agency on Aging facilitates that, just like they are for the vaccines and things like that.
Yeah, thank you for that. What would be the interaction if someone is currently receiving a Section 8 voucher? Are they still eligible for this program?
So yes and no. So so Section 8 actually is part of, like that goes directly to the landlord. So that Section 8 payment never goes to the individual, it goes to the landlord. Now, if there is Section 8 money, depending on where that factors into the formula, the person could qualify for their private portion, depending on where their income is, versus their rent. But remember, so somebody who has a rent of, let's say, $800, 600 of that might be on a voucher, and the question becomes the $200, do you really, like, what's the need there? Most people in that situation really have a need for utilities.
And then one other thing, what is the administrative charge that will be?
So the administrative charge varies by different programs. We have contracts through Human Services with our tenant navigators, and we have contracts through DCED. Those have not changed based on the original programs. So it's a volume number. I don't know what the particulars are of each particular contract. It also is for coverage areas. So New Bethany Ministries covers one area, Easton Neighborhood Center Project of Easton covers another. So those are it's all worked out, and their contracts are different based on, the other. And some of them are not just tenant navigators, they do, other types of services to help with housing sustainability.
Yeah, no, my beef is always just, I want this money to go to the people that need it, not to a
It's-
bureaucrat.
And yeah,
So-
the county is not taking any of our money coming through. We're just we're paying the tenant navigators.
Okay, thank you.
Mr. McGee?
Back one thing, back on Mr. Kuzic. Now, the Section 8s, would seniors be considered some Section 8s?
It depends on who has a voucher, but yeah, there are seniors who do live in some Section 8 housing. And yes, if, there are those complex cases, and oftentimes our Area Agency on Aging, or DCED, is well aware of where that low-income housing is. And I know that they have been, targeted for assistance as well, to make sure that money is getting into the people who need it most.
Thank you. Mr. Myers?
Just to follow up on that has also helped some Section 8 people with the utilities.
Yes, oh, absolutely, yes.
That's the key for the Section 8 people,
Yeah.
that their utilities are being taken care of. That's more important than anything else, because you're gonna have all the rental in the world. If you ain't got no water, you're out the door. So we gotta make sure that's taken care of. Thank you.
Mr. Heckman?
Because of you ask about the fees, and I think, unless things have changed, and I know we're talking about new monies coming in because of what's going on, but it either works out that the department or the division negotiates with each vendor, and this would be a vendor in point, a rate that, either they're going to meet or not, or it's dictated by, let's say, the feds or the state, and they'll say, look, you can go up to a certain amount, but that's it. Now, I don't know the case with this, but I would say it's either been negotiated by the department or they were given a range, and that would be it.
Yes, and our tenant navigators are wonderful partners with us. I have not had the discussion with Robin or Sue, now I don't know if that might be coming soon, about, they're processing more applications and they do need help, or there's whatever's involved. But we haven't had that discussion yet. We have good partners in that regard.
Ms. Fargo Hefner?
So how many people do you hope to service through the, because like I know when we had other money, it was like, here's the amount, no more. How are you gonna?
So
really
it's
figure out
based
some of
on,
that?
so right now, the supply of money is enough to sustain us, but the demand is only going to grow. So right now, there's not a critical crisis, like with availability of money for people who want or need the assistance that qualify. Okay, that qualify. However, that could change depending on, they say the pandemic, we might be done with the pandemic, it's not done with us. That could change. So as I stand here right now, I'm not worried about running out of money or setting up limits on anything. However, that could change.
'Cause I don't think that answers my question. Like, I guess I want to understand the mechanics of how it, when I send it, and maybe Robin knows the answer more than, I'm going to put in an application, is it X dollars for so many
No,
months?
it's
Is it for
your
6 months?
it's 12 months. Starting on a certain date, you're only eligible for 12 months. Or did it extend to 18 now, Robin? I think it's up to 15. That's right. It's up to 15 is the max now. And it's what your rent is. So if your rent is $1,000 a month and you qualify for rental assistance, you could
So
get
I
up to
it for 15 months if I
$15,000.
qualify.
Yes.
Or in some cases, a portion. as you
Or in some
described.
cases, a portion, yes, depending on if you're getting other assistance.
So is it first come, first serve, or is it identified by those partners? Are you delineating the money to the 5 partners?
It's,
equally?
there's no money delineated to the partners. We take the people as we get them. Anybody who's put in an application has been considered. If they qualified, they've gotten their money. Again, we're not at the position yet. We haven't had to make those decisions. Knock on wood, hopefully we don't have to. But it seems like we're going to have enough money to meet the needs of people who qualify.
Does that answer your question?
Yeah, I think it would be interesting to hear down the road how many people actually got.
We're keeping
As we
track of
said,
some of those statistics right now. We're well over 1,000 people that have been helped in the program just in the short period of time. But we'll keep those statistics for you and have them.
Thank you.
Any other questions? Motion to move?
So moved.
Thank you. Any other thing for finance?
Yeah,
Mr.
Real
Kuzic?
quick, while Mr. Barron's here, can you give us an update on the audit? Is it going to be delayed again this year?
Yes,
RKL?
so
We talked to them.
council also has a decision to make with regard to the external auditors because they are up at the end of this year.
That was
Now, I
my
know-
next, yeah.
Yeah, I know Mr. Basile is not here. They've gone through the process of what we need from the external auditors, what the engagement would look like, and I believe it's going to be coming to council relatively soon to go out for RFP. So yes, it is going to be delayed. The things that delay the audit and what have caused the delays are simply the new Gadsby standards that we have specifically with regard to the OPEB fund that we created. Because there's not only a pension actuarial, there's also a health insurance component to the actuarial that just makes things crazy. And then, of course, the P3. Mr. Dertinger always bugs me about evaluations and values of bridges. And those are the kinds of things we have to work out, and it's not a very easy audit, especially when property transferred that, while I understand why it did, it was not really intended to. And so what's the value of a bridge? That's the million-dollar question. So we work on that quite regularly, so.
Okay, thank you.
Anything else? Motion to adjourn? Okay, thank you.
Ooh, Lori and Bill, I need you to sign something, please.
By the way, that was for you yesterday, right? Email I forwarded to you for the UCC.
Yeah,